Well, it also, I guess it would depend on the type of dog, like the behavior of your dog, and whether you're giving pill form or liquid form of medication. So for pill form, very often just mixing the medication, like a small pill, you can mix it in a little ball of food. And very often if you disguise it well enough and just give it, and we'll pretend over here. So it's just a little piece of hot dog, but we'll pretend there's a tiny pill in it. And very often the dog will just, and it's gone before you know it. So that sometimes works really well. So the less stress on them, the better. And this is a great patient. There are these things that are out there called greenies, these pill pockets. And so what these are designed for is, they're actually like a treat, and as you can see, Max here really wants some of those too. And you actually put the pill within it, so it just saves you getting the little mishmash of food and putting the pill in, and then you will usually take those. So pretend that we just took, our dose of antibiotic. Sometimes you have to be, we'll let you swallow that first, buddy. Yeah, you'll get another one in a second. Sometimes you have to be a little bit more, a little more handling. And so we'll just pretend the pill is in my fingers over here. Sometimes you actually have to get it to the back of the throat because they'll fight you no matter what. And so it's just a matter, sometimes maybe you'll need someone to help hold or not. It's opening the mouth up, pretending the pill's there and trying to just get it quickly to the back of the throat and close the mouth. And oftentimes if you hold the head up and if you just even blow or add just a drop of water, you get that lick. And once you get that lick or swallow reflex, the pill has gone down. And if you're not sure, or if you just want to help them out a little bit, having just a little syringe or a little eyedropper with just plain old water after they've taken the pill, it's just a drop just in the side, and that was just air, not even water, and you get that lick reflex and it goes down. For oral medication, and oftentimes antibiotics or other medications are given orally, the trick is not to give it really quickly. It'll just splash right back at you. Some of them, they don't like the flavor. So we'll pretend there's a little bit of amoxil in here. And the trick really is, or at least my trick, everyone's different in how they do it, is you just really want to get the medication just in that little pouch. And it's just very slowly. And even with just a little air in there, we just slowly swallow. So having patience, let it swallow, don't let it just backsplash, and usually they'll be pretty good. So our buddy here has just been absolutely excellent, and you get a little treat for that. So cats sometimes are not as easy for giving medication. Sometimes pills can be very difficult. Their claws come out. So restraining them, sometimes you might even have to wrap your cat in a towel. Sometimes just having someone hold the front so they can't get to you with their claws as they're doing it is really important. There are cat pillars out there, and they kind of look like a little prong that holds the pill and a little push. There's mixed feelings about those because there's always a chance of aspiration if you get a little too aggressive. In a professional hand, we use them. Dispensing them to a layperson, you'd have to be very careful with them. With cats, it's especially important. They say that most pills can cause an inflammation of the esophagus in cats. So it is kind of important in a cat that after the pill is at the back of the throat, always having a little syringe with just a few drops of water. It just aids the pill to go down, and it sort of just cleanses that little bit of medication to go down as well. And again, with cats giving oral medication like liquid, which we tend to do quite a bit, patience is the real key. It's very frustrating sometimes. Your cats get used to, they know you're coming. If you have to medicate twice a day for a week, they see you and they hide, and it's a very frustrating process. So patience and give it a little bit of time.